Debbie Seidel Bittke, and welcome to week 3 of our trainings on 5-star dental hygiene care. And I'm going to talk about treatment planning this week. I have one suggestion that I'm going to make that will simplify your patients saying yes to the treatment that you're recommending. So follow me through this. Treatment planning is the process of using critical thinking skills to decide the information that's taken in during data collection and what is pertinent to that patient. And then you organize this data in a concise list of the clinical situations. For the dental hygienist, I recommend that you first discuss the patient's restorative needs. It happens too often that dental hygienists are focused on the perio and then forget or run out of time to discuss restorative needs. So I recommend that you begin as a hygienist talking to the patient, your patient, about their restorative needs. And then when speaking with your patient, you're going to say phrases like this: "What we see today," or "Remembered, Mr. Jones, what we saw a few minutes ago." And it's that change in a word. Instead of telling the patients what you find, change it to a word "see" or "what we saw in your mouth." I have heard too many patients complain that they feel like all the dentist does when they come in for a dental appointment is find something in their mouth. So let's nix that word and change it into something else, so that when also you're looking in the patient's mouth, create a partnership with your patient. So during the data collection last week, I explained a way to engage your patient. And then now when they're seated upright in the chair, you have an opportunity to plan the treatment together. And that's clinician and patient. You'll show the patient what you see by using the intraoral camera photos. Maybe you're going to use some brochures and highlight those brochures, circle some of the words that pertain to that patient. I like to print out a periodontal exam chart, the patient's chart, from the computer, and I'll highlight areas of concern or areas that need treatment. And so you're going to have those pictures ready on the computer monitor. You're going to have your posters or your brochures at hand so you don't have to get up and leave the patient. So you're reviewing what you saw during the data collection and then prioritizing a list and discussing this with the patient. It may be that doctor wants to be the one to prioritize the treatment. Makes perfect sense. But this is something that needs to be your philosophy for treatment of your patients. So discuss that as a team, and then doctor can talk about the priority list with the patient during the hygiene doctor exam. When discussing the treatment plan, each clinical condition will be matched with the appropriate treatment, and it's within the context of each patient's individual overall health. And equally importantly, it's the patient's personal preferences. It's important to understand each of your patient's personality types. There are 4 different personality styles, and your patients may fall into 1 or 2 of those as their primary type of communication. So understand how your patient communicates best. For example, some patients just want to know a little bit of information. You tell them what they need, and they're there. They believe in you, you're the expert, and they'll do what you say. Now, contrary to that, that's a perfect scenario, but contrary is that these patients, most of our patients, want to know more information. And so if you understand what makes your patient tick, then you can speak to them in a specific way so that they understand and are more likely to say yes to accepting your care. And if you know your patient's objections ahead of time, you can speak in a way that overcomes those objections before they become a major concern to the patient. So understanding those objections and being proactive before they actually become an objection is so helpful in the treatment and planning process. For example, if the patient has a challenge about time, they don't want to leave work early and come to a dental appointment. Speak to the patient about this situation, and do you have hours available that are outside of that patient's work hours? What can you do when you understand your patient's needs to serve them best? And when you have a complex treatment plan, it's possible that your patient may need to schedule an additional consultation. That might just be a 20-minute appointment. Continuing this process, I want to just highlight that you're going to sit your patient upright in the chair when you're discussing the treatment plan. Show the patient what you see, discuss the restorative needs first, and ask open-ended questions. These are questions that you ask, and they require more than a yes or no answer. Are you already doing these things with your patients? If not, do you find that it could be helpful for you to do it this way with your patient? For those of you who have been doing it this way, will you please comment below and let us know how that's working for you? And I'll talk to you next week. We're going to talk about the doctor hygiene exam. See you next week.